Oh my God, it's the scariest thing that you could ever imagine. You just think you're invincible. I was only 44 years old. They're like, there's no way. When she told me I had breast cancer, I'm like, what do you mean? How can that be possible? You know, that's just, I just had a 3D mammogram. Like, yeah, you guys told me everything was fine. How can this have been missed? Like, I don't understand. I did everything I was supposed to do from the time I turned 40 on up. He said, Margie, you have dense breast tissue. Like trying to find a golf ball in the middle of a snow blizzard. My daughter, she was probably one of the last people I told. She said, are you going to die? And I said, absolutely not.
What is dense breast tissue?
It's basically fibroglandular tissue that looks just like cancer on a mammogram. And basically it's just dense. Your tissue is real dense.
What is Margie's Law? What did you guys get passed here in Georgia?
It was my way, by doing all this research and knowing that there was already somebody out there, Nancy Capello, that was leading the charge, and Georgia still wasn't part of that. And I was so angry about it, something so simple. I was like, this is how I am going to turn when I have something positive. And as long as I have a breath in me, I'm going to make a change in Georgia.
Margie, thank you for joining me today.
Thank you for having me.
Absolutely. Do you remember the moment that you felt like something was wrong or different about your body?
Yes, I do.
What was that like?
Just a massive amount of questions and fear and, oh my gosh, what could be going on with me? I wanted to find the answers as quick as possible. Panic, just the uncertainty of everything that, could come in the future.
And what gave you that realization that something could be wrong?
So, I had been feeling a knot in my breast for about a month or so, but I thought I had just went for a 3D mammogram, which was the latest technology, when I got diagnosed for breast cancer screening outside of the ultrasounds, the MRIs, but there was really no reason for me to get that. So the 3D mammogram, I thought everything was fine, but I kept feeling this knot on my chest, and I was like, and it was tender to the touch, and it was really hard. I thought, well, maybe I'm just hormonal. I'm 44. I might be going through the changes of all the things. And I'm working the hospitals in the medical device world. And I had mentioned it to one of my nurses, and she felt it. She's like, Margie, you really need to get that checked out. And I was like, oh, it's probably nothing. She said, no, I'm serious. You need to get it checked out. And, so I let it weigh on my mind for a minute. And then I happened to run into, one of my plastic surgeon doctors that I worked really closely with. And I said, I'm glad I ran into you. I need you to check something out on my breast here. It's kind of hard. And just wanted to see what you think about it. And so we stepped into the surgeon's lounge, and, he kind of palpated it. He's like, well, when did you have your last mammogram? I said, I just had it 6 months ago. And he said, well, this time I want you to go back and have them order an ultrasound on top of the mammogram. So when he got concerned, I really knew. I was like, something's not right. So I could not get over and get my ultrasound scheduled quick enough to try to get those answers. So it's definitely a lot of, oh my gosh, this can't be, total panic mode, all the things that you can even remotely imagine just coming through your mind.
So walk me through that ultrasound. I'm assuming you did go get the ultrasound.
Yes.
Walk me through the ultrasound all the way up to the diagnosis. What did that look like?
So I will never forget it. It was Valentine's Day or the following Monday. It was a Friday that they scheduled me for an ultrasound and another 3D mammogram. And we did the 3D mammogram. Radiologist said that's fine. We went and did the ultrasound in the next room, and I sat there for a while before they came back. I'm like, something's not right. And so then the nurse came back in, and she said, we need to get another 3D mammogram. And I was like, what's going on? I knew at that point, just being in the medical field and everything, I was like, this is not normal process. I'm like, something's not right. They're like, no, we just want to take a look, second look. So they did that, and after that, by this time, I'm already panic mode, like tearing up. Oh my God. It's the scariest thing that you could ever imagine in life as far as having to you just think you're invincible. I was only 44 years old. They're like, there's no way. This can't be happening. And so after another mammogram, they wanted a biopsy, and then I knew then. I said they've seen something. They know something's there. Now they just want a biopsy to confirm things. So did all of that. Of course, I honestly did not say a word to anyone the whole weekend. None of my friends, not even my husband, nothing. I just sat on it because I'm like, I'm gonna pray this away. This is not gonna happen. I'm gonna be just fine. And then the following Monday, they called me back. My doctor called me and said I had been diagnosed, or I had breast cancer. And yeah.
And at what point did the phrase dense breast tissue come up?
Oh, goodness. So that, and well, I had to ask those questions, right? I'm like, when she told me I had breast cancer, I'm like, what do you mean? How can that be possible? That's just, I just had a 3D mammogram. Like, yeah, you guys told me everything was fine. And she's like, well, let's get you into the breast surgeon. She never mentioned dense breast tissue at all. My original doctors, but she's like, let's get you in the breast surgeon. Let's go in, because being in the medical device world, and as soon as I got diagnosed, I mean, it was like, okay, let's get this scheduled. I'll see you in the OR tomorrow morning at 7:00. We're going to take these off. Like there was no doubt in my mind. I'm like, whatever it is or wasn't, but it didn't matter the size, whatever. I wanted it gone. And they were like, it doesn't quite work that way. But anyway, when I met with the breast surgeon, he was explaining to me, he's like, well, I was like, how, and I asked him those questions. How can this have been missed? Like, I don't understand. I did everything I was supposed to do from the time I turned 40 on up. And, he said, Margie, you have dense breast tissue. He's like, trying to find your cancer in your dense breast tissue is trying to find a golf ball in the middle of the snow blizzard. And I was like, what are you talking about? Like, I had never heard about it. I'm like, what does that mean? And so he broke it down to me, and I was like, something this simple is missed, and because and y'all knew this could happen, and you don't bother telling people that. I mean, I was outside of, because I was angry that may just started making me really angry at that point.
I could imagine.
I was like, are you kidding me? I'm like, this now I'm going to have to deal with this for the rest of my life. I'm going to have to fight the biggest battle of my life, and y'all could have prevented this by telling me something so simple. So yeah, I went from upset, worrying how I'm gonna get this, to mad. I mean, I immediately got angry about it, and so I'm like, okay, yeah, we're gonna fix this. So
for those listening out there now, and they're like, okay, that sounds pretty bad. That sounds like something I should know. Mm-hmm. What is dense breast tissue?
Yeah, that's a great question. Thank you for asking it. So basically, dense breast tissue, there's 4 categories of your breast. There's A and B, which you can basically see on the 3D mammogram and pick up any cancers whatsoever. But then when you get into category C or D or 3 or 4, it's basically fibroglandular tissue that looks just like cancer on a mammogram. And basically it's just dense. Your tissue is real dense, compromised, a lot closer. So it's hard to tell. Dense breast tissue looks just like cancer on a regular 3D mammogram. You can't tell the difference. And that's why cancers are missed with women with dense breast tissue, C or D.
How often is it missed?
That's another great question. And these are not my stats. These are studies that are out there, been published. So the patient population, women, 40% of the patient population have dense breast tissue. And of those women, a 3D mammogram is missing a cancer 50% of the time.
40% of women have dense breast tissue.
Mm-hmm. 40 to 50% of women have dense breast tissue.
And then 50% of the time, cancer is missed.
Yep.
If you have dense breast tissue.
Correct. Studies are out there. You can Google them, whatever, pull them up. It's all backed up.
Wow.
Yeah.
And I was reading that you're more likely to get breast cancer, if you have dense breast tissue as well.
Correct.
How much more likely?
So if you're category C, you're 2 times more likely of getting breast cancer. If you're category 4 or D, you're up to 4 times more risk of getting breast cancer. It's because of the molecular makeup of the tissue. And so not only are you at increased risk because you have dense breast tissue, but then it's going to get missed on a regular 3D mammogram. And that's why it's so important to take it one step closer and demand your additional screen, whether that be the ultrasound or the MRI.
Why do you think this was missed before? It seems to someone like me, it seems so obvious if you go down that track, right?
So simple.
I believe it's 1 out of 8 women will have breast cancer at some point in their life.
And honestly, it is. That's great. Yeah, but I'm confident it's probably more than that.
Really?
Yeah. But I mean, I'm obviously, who am I to say that? I'm not a doctor or anything or do the
Say
studies.
it's
but
even that.
it's it's 1 in 8. Yeah. So I'm sorry to interrupt you.
No problem. Say it's even that. And then 40 to 50% of them have dense breast tissue, and half of them are going to get missed cancer, and they're 2 times or more likely to get cancer.
Something so simple.
How many women, I mean, we could do the math, but how many women out there
could be saved? Or find the cancer early and not have to go through the extensive treatment. So, whether it be chemotherapy, radiation, multiple surgeries, all the things. I mean, you can't imagine. That's when I've got diagnosed and they started explaining it to me. So of course I'm a researcher. I like to go. I'm like, I'm going to figure all this out. What is this dense breast tissue? All the things. What does this mean? And so the more I researched and the more I uncovered everything that was going on, the late Nancy Capello, she started the charge back in 2000, I think 4, because she was diagnosed with breast cancer. Hers was missed because of dense breast tissue, and back up in New York area. But she actually led the charge to get all these states on board to have a law in place to notify women if they have dense breast tissue and explain to them what that means. She basically, when I got diagnosed, there were 32 states that already had a law in place with that. And she was my mentor with all of it. And of course, through my research and everything, I'm like, why does not every state have something like this in place? Like it just doesn't make sense. It's something that's so simple that can save so many lives, and just it didn't make sense. So, yes, and now I'm thankful that the FDA has mandated it for the whole United States to have something like that in play.
Well, even before that, you were a big instrument in Margie's Law, right? So tell me about Margie's Law. What is Margie's Law? What did you guys get passed here in Georgia?
Yes. So that actually, when I got diagnosed, obviously, I'm a very strong, independent, lone wolf, self-sufficient. I fix everything for everybody else, right? And so when you get diagnosed with cancer, you can't. I mean, with the treatment, depending on the stage of whatever. Like I was stage 2. There was no doubt that I was going to have chemotherapy, radiation, double mastectomy, reconstruction, all of that stuff. And even the strongest people, the strongest women in the world, when you get hit with something like that, and you think you're going to be able to do it all, it was hard for me to step back and allow everybody else to help and give and do, because I was the one that did all that for everybody. I fixed everything. So I'm getting sidetracked here, but it was my way, by doing all this research and knowing that there was already somebody out there, Nancy Capello, that was leading the charge, and Georgia still wasn't part of that. I was so angry about it. And something so simple. I was like, this is how I am going to turn what I have, this unfortunate C word, to something positive. And as long as I have a breath in me, I'm going to make a change in Georgia, and I'm going to make this happen that nobody else in the state of Georgia, my friends, my sisters, my nieces, my daughter, is going to get diagnosed with cancer because of dense breast tissue and the cancer was missed. So
you had some.
It was my way of just kind of turning it and taking all that turmoil and all that anger and all the, how can I help everybody else? Because they're all helping me, make a difference. So.
But then you had some pushback, correct?
Oh, yes. Lots of pushback.
Why do you think that was?
Politics are politics, right? And when we went down when I started this journey, my background is I was, always been in some type of business sales. I had pharmaceutical sales, hospitality sales, med device sales. So I knew how to put the package together, and with all the information that I had gathered and stuff, and the studies and all that stuff. And I told myself, and I told the people that were surrounding me, I am going to give them no reason to tell us no. This is a bipartisan issue. We're going to knock on everybody's door, whether, it didn't matter, and we're going to inform them of this. We're going to let them know, what's going on. So, and anytime they did try to go down that rat hole, well, they're doing this, so we're not going to do this, and blah, blah, blah. We had all that presented to where it's a bipartisan issue. This can affect everybody. This is not about, and we just had to sit down with them and have those conversations over and over again. I think I made 7 trips up here, just knocking on doors with, some friends of mine, or, we have a young lady, her diagnosed with breast cancer. She had 4 small children, was missed by because she had dense breast tissue. She came up here with us a lot, and it was grassroots efforts. We just knocked on doors, we emailed, we called, we did all the things to finally they just started listening. So it's like, and I think, like I was telling you earlier, Adam, I'm the vessel. I think God used me. But then we had a perfect alignment of all the stars. We had some, executives and CEOs of, medical device companies. Then we had, other, women that were passionate about this, that, were very, prominent within the state of Georgia, that had the connections, with the, specific politicians. So, and of course I had my army of, women and men too, that were, around us. So I think it was just pure determination, and all the stars aligned. I was the face and the vessel with my background that I always had, and just putting all those people in the right place and making that army, push forward. That's how we made it happen.
Do you have any idea of why dense breast tissue wouldn't have been something that was extremely important in the past? Is there any logical reason that you could think of that anyone out there wouldn't notify this? It seems like something, for me, it seems like something so obvious, right? It seems like this should have been the moment that they discovered that this dense breast tissue exists, that they should have been notifying people.
I've got a lot of theories, and I definitely want to be politically correct. I don't want anyone mad at me or you for having me on the show. But I think politically, a lot of politics come into play. Insurance comes into play.
I see.
Societal guidelines come into play. It's really like a game.
There's a lot of money to be had in cancer games.
Yes. And actually, that was one of the things when I got diagnosed. My doctor told me, and then I'll never forget it. After I'd already met with the breast surgeon, she called me. I was sitting, driving or whatever. And she's like, I just want to check on you, how you're doing. I said, did you know anything about this dense breast tissue stuff and how it affects, you getting cancer? And she's like, well, yeah. And I was like, well, why didn't you tell me about it? And she's like, well, your insurance wouldn't have paid for it anyway. I'm like, no, that's not for you to decide. You're my doctor. I mean, my head literally spun around. I'm just like, no, that's not for you to decide what I can and can't afford and what my insurance will pay for or not. I said, do you realize how much it is costing every time I sit in that chemo chair? And now I have to worry about this for the rest of my life. This will never go away. I'm still on medicines I've got to be on for another 3 years. And then I still have to worry about reoccurrence down the line because it was already on my lymph nodes and all the stuff. And she just stopped and, it was kind of quiet. I said, my point. I said, it's your job to notify me of what could be at risk and let me make those decisions as far as how I want to handle myself. So it's that type of mentality. It's the insurance companies. It's the politics that come into play with it. It's the societal guidelines for women's health are light years behind where they need to be in the state of Georgia. And I hope I don't upset Georgia societal OBGYN society, but it's the truth. And I won't say that, but I just always joke if I say if it was about a man, it would have probably been taken care of a long time ago. We wouldn't have had this issue. I mean, I hate to be that way, but it's the truth. Just anyway, that's a long answer to a short question. But.
No, that's fine. You said that you were still undergoing some sort of treatment. What treatment are you still?
Yes. So I was diagnosed with triple positive cancer, breast cancer. So that means I can't have any hormones whatsoever. With my triple positive diagnosis, it's called HER2, which is a very, very aggressive cancer. And because it was already in my lymph nodes and everything, I have to take a pill daily. It's cancer prevention pill. And it wreaks havoc on your body as well. So it makes you very tired, very ill. Your hair fall out, body aches all over. And they say I just went to Mayo Clinic last week, and I was like, "Can I quit taking it?" Because they say you're supposed to take 7 to 10 years. I'm like, you might need to take it a little bit longer because I just had some liver lesions pop up. So we're good. We're just watching them, but they're like, well, let's keep you on it for another 10 or three more years. So it's just part of cancer. It's part of what comes, depending on what type of cancer you have and stuff like that, and what stage and all the things. So the good thing is, I think they have come a long way with the treatment of cancer, but it's breast cancer or any cancer, but it's brutal. It wreaks havoc on your body in all shapes, sizes, forms. It's nothing that will ever leave you. Ever for the rest of your life.
As far as treatments are concerned, you did a lot of proactive work in your treatment. From everything that I saw, you were calling doctors from all over the United States. The first one, if I remember correctly, was Dr. McLeod. Is it
Matthew McLeod?
McLeod. Sorry, yes. McLeod. Yeah. And you called him and explained to me that sort of process that you went through.
So I started doing some research about double mastectomies and breast reconstruction. Like I told you a bit ago, there was no doubt in my mind that I wanted them gone. If there was any risk of it ever coming back, it just had to be done. So I just started doing a lot of research and the different techniques, and because there's so many different things that they can do, right? And I always tell my friends and people that I talk to that are newly diagnosed now to this day, you have to be comfortable with your plan. You've got to get your plan in place. You can't listen to the outside chatter because everybody's going to be coming at you with their different opinions, and we should do this and you should do that. But until you're comfortable in your heart, your mind, and your soul with your plan, because you're the one that's got to live with that if anything goes awry or what have you. So to that, I just did a lot of research, and I was angry at the moment because Savannah, in my opinion, had missed my cancer, right? So and there's great doctors in Savannah. However, and I was just angry at the moment. I'm like, I'm going to reach out and do all things, leave no stone unturned. When I get my plan in place, it's going to be solid, and I'm going to be able to live with it for the rest of my life. So there was a young man that I heard that was coming. He was finishing up his training in Boston. He was fellowship trained in breast surgery. And I heard he was coming to Savannah, and I had some background, some other folks in Savannah anyway. So I'm trying to be politically correct. But anyway, so I reached out to him via Facebook Messenger, to be quite honest. Hi, my name is Margie Singleton. You have no idea who I am, but I hear you're coming to Savannah. I would love to talk to you about what I'm going through and possible connecting with you to do my double mastectomy or my reconstructive surgery. And fast forward, he, now we're great friends. But he said he looked down. He was actually getting on a flight to travel somewhere. He said he happened to look down. He never checks any of that stuff, and he said he had like a little notification, and he opened it up and he read it, and he said, I just felt inclined I had to call you. And then he was in Boston finishing up everything, and I'll never forget it. He called me, and my husband and I sat on the back porch, and we talked to him for an hour and a half. And and he said, Margie, when we hang up here, if you want to go with somebody else, I totally understand. He said, but I'm here to help you through it all. And even when I get to Savannah, if you go with someone else. I hung up the phone. I told my husband, I said, this is my person. This is exactly, because he went through all the different procedures and it was just what I was looking for. And I was his very first patient in Savannah, Georgia. Yes. Oh. And here we are. Yeah. 7 years later. So.
And for those out there that may want to know about that process, or if they want to consider it themselves, what did he do for you?
So my breast surgeon did the whole complete double mastectomy, right? And then I did the whole same day procedure. I basically did the double mastectomy, and he did the reconstruction that day. It was a 9-hour procedure to do all of that. And with all that comes along, there's so many risks associated with any type of big surgery like that. But then when you're doing the reconstruction, the implants may not take, the skin may die. There's just so much risk of all those things. So you just got to go in it open-minded, ask a lot of questions, do your research. And if you, and basically, yeah. And so I actually did all that. I was lucky. I healed pretty well. He did do some fat grafting to kind of fill in those areas. Because, I mean, with double mastectomy, they take everything, you know. I did pretty well. And then about a year later, we did another reconstruction because everything kind of stretched out and, you know, moved around. So, yeah.
How is it different than any normal reconstruction?
So he actually, when I got diagnosed back then, they weren't doing nipple sparing and procedures in Savannah. So that was one thing that was kind of important to me. So he did that, and he brought new technology. Yeah, new technology. And he had seen some horrific scarring on folks and stuff like that. My scars are minimal. I mean, he just did an amazing job with everything. So, yeah.
And it didn't stop there. You also did the platelet-rich plasma treatment for hair. Walk me through what that is.
Yes. So that basically is when I got diagnosed, of course, I'm just going to backtrack just a tad bit. So my daughter, she was probably one of the last people I told. I wanted to make sure I had all the plan in place. This is exactly what was going to happen. I wanted to be able to look her in the eye and say, I'm going to be okay, but this is what we're going to do, you know, because I wanted to make sure she had fully understood it and, you know, reassure her as much as possible. And the afternoon I sat her down and was talking to her, she said, I said, I got to talk to you. I think she was 11 at the time. And I said, I've got to talk to you. And she said, you have cancer, don't you? So how did you know that? And she said, I just had a feeling. And I don't know if I tried to hide it as much as I possibly could. And she said, are you going to die? And I said, absolutely not. And she said, are you going to lose your hair? Because at that time I had long, just beautiful brown hair. And I said, I might. She said, I don't want you to lose your hair. I was like, okay. Or if those are I said 2 questions or, you know, once that she had, I was like, I'm going to keep my hair. I'm going to figure it out. So I did a little bit more research on the cold caps, and the cold caps actually preserved my hair. It did, you know, with the chemotherapy, I was able to keep it look as normal as possible. Like, I don't think many people knew I was even going through cancer treatments when I was doing it, besides just losing the weight. At the end of it, though, it did start to, you know, kind of fry up and everything, and part of it did come out on the top here. And so what you're talking about with some or newer technology, I think it's now been around obviously a little bit longer, but it's basically they take your plasma, they mix it up, and they resubmit it back into your hair, and it generates faster growth of your hair to come back.
Oh.
So it's your own plasma. Mix it up and put it in there, and it makes your hair grow back quicker. So it worked out. Yeah, it worked out great.
How does the cold cap work? What does that
look like?
Cold
cap is a lot of work. It's a lot of work. I think during my time too, it gave my husband and my daughter something to do, right? And so to feel like they were being a part of it, because I'm not kidding you when I tell you I was surrounded by amazing friends and family and just a solid support system. Gosh, I'm very lucky in that regard. But they actually, the night before my chemotherapy treatments, we had to get dry ice, and they'd sit out in the garage and break all that dry ice down with their hammers and all that stuff and put it in the cooler. And then the next morning you've got this cap, and you have to put the ice on, inside, and wear this cap for I can't remember now the time. You had to work so many hours and then so many hours after treatment. So you're freezing. Your head's it's freezing the whole time. So
a dry ice cap.
Yes. And it is so cold. It's like you have to wear gloves and all the things. But I guess the mechanism, I can't recall off the top of my head now at this point, but it basically keeps the chemotherapy from getting into your hair follicles. Yeah, by just making everything so cold.
Would you do it again?
No. Sorry, cold cap people. No, you know what? Yes, if my daughter would have come to me and say, those two questions, are you going to die? And I don't want you to lose your hair. Absolutely. I would do anything in the world for my daughter. So, but in hindsight though, because it is so much work and you have to wear it for so long, even when you're after treatments, I think, you know what? I would own it. I would just shave my hair, be bold and beautiful and bald and all the things, and just not try to preserve something that was going to ultimately have to grow out and all that stuff again anyway. So, but yeah.
Sure. So you said, going back to your treatment now, you said that, so you had chemotherapy, you had, what did your treatment process look like?
So, unbeknownst to me, we just couldn't go into the OR and remove everything, right? So I was like, are you sure? And of course my husband's like, you're not thinking clearly, just hold on a minute, but so what they wanted to do is stop the growth of the tumor and shrink it before we operated. So then, because it was HER2 positive or, an aggressive cancer, they wanted to stop it. So the first step was I had to go through 6 rounds of chemotherapy, once every 3 weeks. So, the first 2 rounds, I don't know how much, people have talked to you. The first 2 rounds were okay. By the third round, it starts building up in your system, and that's when you start getting really sick and really weak, and your body aches. It's like you have the flu 24/7. And the time after your chemotherapy, you feel that way for about a week, and as soon as you start feeling a little bit better, they hit you again, and you're going, so you're like, oh, I can go back to work and do all the things. Yeah, no. And I think it's important too, and I tell people that, if you're strong, you're independent, or even if you're not and you have, just don't try, because it's not, I'm getting rabbled up here, but it's not just making you sick and feeling you sick, but you have no control of anything. Your whole life as you knew it or know it is gone. And for me, I got really tough on myself, and mentally that's what, because I couldn't do anything, I was just stuck at home, and, because you can't go out in public because you're at risk of, because your immune system's so far down and stuff like that. So it's hard. It's a hard journey. While you've got all, people there to support you and stuff, nobody knows what you're going through until you actually go through it. So,
what sort of tips do you have for anybody that's going through that right now?
Don't be too hard on yourself. And it's going to be okay when you get through the storm. I mean, I know it seems like the end of the world, and you feel like you have no control, because you don't. You feel like awful almost every day, but I promise it's going to get better. You just have to get through that storm. And once you get to the storm on the other side, you'll be much better and stronger and wiser and thankful that you made it on the other side. But unfortunately, it's just an unnecessary evil. And for a lot of the women that I talk to, they're very hard on themselves, because we're women. We take care of everybody. We do all the things. And when we can't, it's hard. And I just don't be so hard on yourself. Let people help you. Let people surround and be there for you. And when you're done with this, it's just going to be your turn to pay it forward to somebody else. And so in the meantime, don't get all anxiety and depressed and all the things. Just let it be. And I promise you, on the other side, you can pay it forward.
Is there anything that you did tactically, like therapy or anything like that, during the process, that you can actually do? I mean, all of that stuff is, very positive mindset stuff. But if somebody's like, what should I do tomorrow? Because I'm losing it.
I highly recommend support groups, and things like your podcast, reach out to, and read things like this or listen to things like this. You've got to surround yourself with your support group, obviously, but people that are going through the same thing with you. And then you'll understand that you're not alone, because you honestly feel alone because nobody knows and what you're going through on the inside. And so until you get into those support groups or, some type of therapist or what have you, I was never that type of person that needed therapy or anything like that. But, I did. I mean, I had therapy. I went support groups because, I have felt helpless, worthless, all the things. And so it's not only a physical thing, but it's a mental thing that takes a toll on you and your family and all the things and, that type of thing.
So you had 6 rounds of chemotherapy.
Yeah, 6 rounds of chemotherapy. Rang the bell, all was good. And then we started I'm trying to think. Oh, and then I had the double mastectomy reconstruction. And then we started the 25 days of radiation. And that in itself, it builds up as well. And by day 15, it's pretty much like you're doing chemotherapy all over again. Tired, nausea, it's just sick. And yeah, so it's just a necessary evil. And then once you get past that, then you're good to go.
Then all you have is 10 years.
10 years of the pills. And then, of course, you always have to go and do the yearly screenings or every 6 month screenings and stuff like that and pray that you're not ever going to get a result back that says, guess what, it's back. Because, when they do, when they remove all your breast tissue, if it comes back, it's going to come back to your bones, your liver, your pancreas, your lungs, all of that type of thing. So it's always in your mind, the fear, and you just go down and you do all your screens and you just hold your breath like, please God, let it come back, okay, this time, so anyway.
How soon after your treatment or after ringing the bell, I guess I should say, did you start lobbying for Margie's Law?
We did that while I was in treatment.
Really?
Oh, yes. I came up here. Yes, sir. All the time to, and just, if I had a good week or whatever, by the time we were going through that, I knew when I was going to start feeling better, and I would plan my trips up here around that. And then if I was at home, obviously I was doing phone calls or emails or virtuals, having those conversations. But I did that. See, I finished my treatment in late 2018. We got the law passed July 1st, 2019.
Wow.
Yeah. So we were doing all of that. Yeah. In the process.
How soon after your diagnosis did you start lobbying for Margie's Law?
I think I started immediately. As soon as I started getting all my information together, it just gave me something to focus in on and hone in on. And I'm like, I cannot believe something so simple, so just. And you got people's getting diagnosed with cancer. So, and that goes back. I don't want to repeat myself, but I'm going to. God used me as his vessel. There is no doubt in my mind. Because there were days I'm like, why? Because that's where you go through all of that. Why, God? Why did you do this to me? What, all the things. And and one day I was like, because he knew I was going to do something with it. I was going to, and that's the only way I can describe it or explain it. And to this day, even when we got the law changed, I was like, okay, my work's done. Did everything I was supposed to do. Moving along. And we were coming back from vacation from the lake. And I looked over the lake and it hit me. And I was like, I looked at my husband and said, I'm not done yet. He said, what do you mean? We've been living this for, what do you mean? I was like, I've got so much more to educate and do for women with dense breast tissue and that are fighting breast cancer. So that's where Margie's Army went to Margie's Army Foundation. And that's where we're now focusing in on helping women and families fight breast cancer, whether that be we pay their bills, their rent, their, gas, all that stuff. Or we every October we go around to all of the infusion centers and give out, gifts of blanket and love and all of that stuff. So, and I do lots of educational events around breast density and your increased risk and that type of thing. So
the education events, what form somebody may want to attend or? Yeah.
So I go, wherever they ask me to go, like you guys here today asking me to, and thank you so much for asking me to, and being part of the Army now to help spread the word around breast density. Because to this day, I mean, here I am 7 years out. There's still so many women that have no clue. When you say, your breast density, they're like, what are you talking about? And it's cancer doesn't care. It doesn't care about your age. It doesn't, and there more and more young kids or young ladies are, getting this. I mean, it's so important, something so simple. And to this day, there are facilities that still are not doing the right thing. Even though it's a law in the state of Georgia, they are still not putting it on their mammogram reports to this day, if that tells you anything. So I'm very frustrated. I feel very beat down sometimes. But then, for every time that I'm get frustrated and everything, then people like you come up and say, let's help spread the word around breast density and how important it is for people to know. So, and one thing I will say, you're not even asking me, but I'm gonna tell you this infuriates me too, is, it's an issue, it's a law now, and now the FDA is mandating it for the whole United States. So that's, says a lot. But for those doctors to say, well, you don't really need additional screening. The FDA has mandated this. And so and I talk to patients all the time. And that's when I go back and say, no, this is the data. This is suggested. FDA has mandated. You demand extra screening. It's your livelihood. And I know so many women, Adam, I can't even begin to tell you the women I've spoken to, their cancer was missed just simple as something just like mine, and it's infuriating. So, and it shouldn't be that way. We should not have to continue to fight to get the additional screening that we need to protect us. It's plain and simple.
It seemed so important as I was going through and preparing for this podcast that I almost felt ignorant for not knowing.
Well, you're still young.
Of course, but it seems so obvious. So I understand how, for someone like you that went through the entire process, I couldn't understand how infuriating that would be. And one of the things that I saw, and I want to make sure we pull it up on the screen, was the imaging of, speaking of education, the imaging of what cancer looks like on a mammogram, and then what dense breast tissue looks like on a mammogram. And they both show up white.
That's the dense breast tissue. But
the analogy that you used, the golf ball in a snowstorm, that is exactly what it seems like.
It's nearly impossible for a woman with dense breast tissue for a 3D mammogram to pick it up.
Is there any way to detect it earlier? Are you born with it? How does it show up later in life? Do you know?
So it actually goes away later. The older we get, the less dense your breast tissue become. But everybody's different. We're all different. We're all made up different on all the things. The only way you can tell if you have dense breast tissue is by doing a 3D mammogram. So everybody should get their 3D mammogram. If you're A and B like this, you're going to show the categories. You're fine if you don't have any cancer with A and B. But if they detect that you have dense breast tissue, you demand extra screening, period, the end. And now they've got a new, not all the centers and everything have it, but they have a new 3D mammogram with contrast imaging. Perfection. They can detect the cancer that way. But if it's just a normal 3D mammogram, obviously you always want to do your self-breast exam. That's the first and foremost. Know your breast. I tell everybody that all the time. Make sure if you feel anything weird or funky, or it may not be hormonal like I was telling myself. It may be something, serious. Just to take care of yourself. And, doctors are amazing. They go to school. They do a lot of good things, but they're not God. They don't have all the answers, right? And so I think I've always said knowledge is power. And, empower yourself. We've got so much technology out there, Google and all the things. Even though you can get down a rabbit hole, just take care of yourself and be your own advocate. I say that all the time. Be your own advocate. Yeah.
And if you're advocating for yourself and you want these extra screenings, is that covered by insurance?
So in the state of Georgia, they did pass an insurance law that if you are high risk or need additional screening, it will pay for it. Not like that everywhere, but thankfully in the state of Georgia, we're there.
What do you suggest for those women that are in a state where it's not covered?
If you have the power and the, first just advocate for yourself. If you bring all the knowledge to them and you sit down, this is, the facts and, know your body, know all the things, they can't deny that. Right. And so you just demand it for, and if you can't, then or, financially or what have you, there are organizations out there that can help with that additional screening. We can, just research those to help get you that additional screening. If you have women that are listening to you today that have connections with the Georgia OBGYN societal guidelines that can help make a change with the societal guidelines, that'd be amazing. It's all of those things that need to be updated and changed and done. So
if somebody were to donate today to the Margie's Army Foundation, where would the money go?
Thank you for asking that question. So we use that for emergency funds for women and families fighting breast cancer, specifically for them. And we use that to pay people's rents, use gas, vehicle, insurance, electricity, groceries, all those things. We also do the gifts every October. When you're going through this battle, you want to feel loved and cared about and that type of thing. And, going through these infusion centers, and we're taking these, care gifts, basically is what we call them, and just have an opportunity to wrap these women that are going through this in love, and, and let them know that we care about them, that we're out there for them. It's like nothing that you can ever experience. So, yeah.
If somebody's going through that right now, is there any way to request help?
Yes. And so you can send Margie's Army Foundation. You can private message us or email me, and I'm sure hopefully we can get you all that information, and we can have them complete an emergency fund application, and basically just fill that out, and then our board will approve or deny it, and then we'll get that money to them directly.
Perfect. Is there anything else as we wrap up that you want to share for anyone listening right now that may be diagnosed, maybe struggling in any part of their journey, any part of their treatment? Is there anything else that you want to share?
I think I just want to re-hone in that, be your own advocate. Knowledge is power. It's out there to go find it at this point in the venture. You're never alone, even though you think you are. I promise you're not. And try to hone in on that, you do have support systems out there. And this storm shall too pass. And as soon as you get through it, there's a purpose and a reason for everything. And gosh knows we don't know. But I promise you, when you get through this storm, there'll be another light at the other side that's bigger and better and brighter than ever before.
That's amazing. Margie, thank you for joining us today.
Thank you, Adam. I appreciate you having me. Thank you so much for helping us spread the awareness.
Thank you.
Yep.